The ROXANE study is a prospective study that we conducted in Italy that was aimed to evaluate the impact of the 21 gene recurrence score on adjuvant treatment decisions for patients with early breast cancer. So we know that there are different gene expression prognostic assays that have been developed in order to assist the clinician on the decision on whether or not administered chemotherapy in patients with hormone receptor positive HER2 negative disease. In particular, the main aim of these gene expression profiles is to identify those patients with a very good prognosis with endocrine therapy alone that may be spared chemotherapy. And the impact, although many of these gene expression profiles have shown clinical validity in different studies, we have two of them that have also shown clinical utility in prospective trials designed to test the clinical utility of this trial. One is the MINDA trial for MammaPrint, and the other one is the TAILORx trial for the 21 gene recurrence score. And this, the results of these studies show that these gene expression profiles may be useful in supporting clinical decisions for hormone receptor positive HER2 negative breast cancer. However, the impact that these gene expression profiles might have in clinical practice is different according to geographic areas. It's different based on the local guidelines that are applied for treatment of early breast cancer patients, and based also on the attitude of local physicians. So our aim was to evaluate the impact of the recurrence score in adjuvant treatment decision in and in Italian reality, in particular in the Veneto region. So we included 9 centers from the Veneto regions. And in this trial, the recurrence score test was available for physicians whenever they were unsure about adjuvant treatment recommendation for a specific patient with estrogen receptor positive human HER2 negative tumor. Patients should have T1 to T3 and 0 to N1 stage breast cancer. So there were no other specific inclusion criteria, and the physicians could ask for the recurrence score test whenever it was unsure about the treatment decision. And we collected the treatment recommendation from the physician both before he knew the result of the recurrence score and after he received the result of the recurrence score. So we included 250 patients, and 61% of them were not negative. So the first result was by looking at the characteristics of the population that was included in this study, was that the physicians predominantly asked for the recurrence score test, used the recurrence score test in 2 specific patients population, either N0 patients with an aggressive biology or patients with node positive disease, and 1 with more indolent tumor biology. And these characteristics reflect indeed the situations with the higher level of uncertainty regarding the optimal adjuvant treatment. And another important result was that even this was a very selected patients population, the use of the recurrence score test still was able to change to induce a change in treatment decision in up to 30% of the cases. And in most of these cases, the change in treatment decision was from chemotherapy to endocrine therapy alone. So even in this very selected patients population, the recurrence score test helped to spare chemotherapy for these patients. And in particular, in the node-positive patient subgroup, the use of recurrence score testing contributed to reduce chemotherapy used by more than a half.